So we have time, I think, probably for a couple of questions. I know we've got some circulating mics going around, so if you'd just like to raise your hand if you'd like to ask a question of Andrew. Please, gentleman over here. Yes.
Hello. Hi. You referred when you started your speech that it's been quite a difficult time recently and it's been a challenging time. I wondered if you wanted to or would share some lessons in leadership, as it were, from a personal experience, whether you could say how, as a leader, it's possible to cope with these more challenging times.
Well, I mean, the first thing I would say is what makes an enormous difference is, what matters is to know what it is you're trying to achieve and why you're trying to achieve it. I mean, if I had felt, for example, that yes, people are, it can be very frustrating because people sometimes just make stuff up. It can get very depressing. And people say, well, if you do that, then that will happen. Well, what you have to do, from my point of view, has been here, is say, and I think actually from my point of view, this is why having a pause, listening, reflecting, being willing to improve, is because actually I don't invest my leadership in every clause of the health bill. I don't invest leadership, in my view, in every paragraph of the white paper. What, from my point of view, leadership is about is having a vision and sticking to the vision. Now, if I thought for a moment that the process we're going through now would do anything other than support the vision, I wouldn't have done it. And I'm not going to back anything from a personal point of view, and I hope that will be true for all of my colleagues in government, back anything that is contrary to the vision we're looking for of empowering patients, of devolving responsibility to frontline clinicians, focusing on outcomes, and strengthening public health. It's got to do all of those things. But I think leadership is, very often management is about exercising control. From my point of view, I don't want to think, and actually the process we're engaged in at the moment is not one that I control. People will say, well, that's perfectly obvious. I don't wish to control it all. I actually think the process by which many people across the NHS, many organisations across the NHS and outside it are getting together in order to say there are ways in which we can do this better is, in my view, absolutely consistent with leadership. Because leadership is about focusing on the vision, not trying constantly to control how people do that.
Thank you. Thanks. Thank you for your question. One more question? Show of hands. I'm trying to spy hands. Anybody with a hand up? Yes. Sorry. Oh, actually, Charlotte. Sorry. I know Charlotte's a fellow, so I'll let.
I just wanted to ask, really, we've talked about the importance of clinical leadership, and just in my experience within my trust, I've been really fortunate to get this fellowship position. But other than that, I don't think there's a wide understanding of how to actually promote clinical leadership within the trust, and I'm just wondering if there are any plans to really, really put something into promoting that so that lots of managers are aware of how they can empower their own staff to do that.
Yes, there are. I mean, and I think actually next week, I think I'll have one of the opportunities to be able to talk more widely within the service of those who have some of the principal leadership roles in the service about how we can develop leadership as a part of the process of giving the NHS greater autonomy and what that means in the organisations that they work in and that they control. And I think from my point of view, we're starting to see it happen. I think we're starting to see an expectation that management is not something in the NHS that is reserved to a professional group called managers. That management is, to that extent, I hope in the years to come, people working in the engineering industry don't say, well, we have engineers and we have accountants and so on, but we have a special separate group of people called managers of engineering. No. What we have, I mean, I understand there is a thing called healthcare management, and it's an important profession in its own right. But actually, I think increasingly as we move forward, we should be moving to a place where there is an expectation that people in the National Health Service, whatever their professional background might be, have it within them to be leaders of the organisations that they work in. It does happen at the moment. I mean, I think something like approaching a fifth of chief executives of organisations in the NHS are from the nursing profession, for example. So, and the idea that management in the NHS is something that is accessible to a management group but not to nurses is absurd, because the character of nursing is to arrive, for example, at the point at which you manage a ward and you manage a department and you manage a hospital. So I think actually from our point of view, if we get to the point where there is an understanding that that process of leadership is something that is integral to the development of professional responsibility, I think that will really begin to change it. We're seeing in hospital trusts, for example, a shift toward what is in technical terms is called service line reporting and so on. I mean, I hate the term really. It's just saying we have a team of people who are responsible for delivering the service. They should have greater autonomy. And it works, you know, you can see that happening. You can see productive wards where nurses are taking responsibility for their ward and they actually significantly improve their performance. And it's not because they've responded to some management set of precepts, it's because actually they're engaging staff. And the ownership of what we do in public services is absolutely important. In private sector, it's taken for granted that people are expected to have ownership of the service they provide, and that staff engagement is instrumental to delivering that. For years, it has depressed me that when you ask through the NHS staff survey, the extent to which staff in the NHS feel that they are consulted and involved in decisions made about their own work, that the figures are depressingly low. And I will not feel that one of the things that I hope would be reasonable for me to be measured by would be the extent to which, by shifting away from top-down bureaucratic systems, we arrive at the point where people genuinely feel they own the service they provide and they are integral to decision-making about the service they provide.
Thank you very much. Thanks for your question, Charlotte. Sarah in the box over there has us on a tight leash around time. Sarah, can we squeeze in one more question? Yes. Gentleman over here. No, we're okay. Another question? Yes, over there. Thank you.
Given the disparity between different GP consortia around the country as to their level of preparedness for the proposals, I just wondered how you were going to ensure that individual consortia have the skill mix and the leadership skills that they need to actually take on this challenge successfully.
Yeah. Well, from my point of view, that is not only part of the job of the, in the NHS, we're looking for the National Leadership Council to help to make that happen. In general practice, we have specifically, because I talked to a large group at the beginning of January of this, a programme that is specifically designed to support leaders of new consortia. We're creating a network across commissioning consortia so that people can learn from and develop their skills from each other as they make progress. You're absolutely right. I don't think consortia are all at the same stage of development. From my point of view, what's very encouraging is the extent to which I'm talking to consortia who are saying, this year, this financial year, we are going to take substantial delegated responsibilities. The number who are saying to me, we feel we would be ready next year effectively to take on the whole commissioning responsibility. You know, Friday, one of the primary care trusts said to me, actually we're ready to go on the 1st of April 2012. Well, that's quite impressive really, when you actually think we're only to that extent 18 months down the line from the starting point. Equally, there are others who it will take longer. And I hope through the NHS Commissioning Board, which itself should provide leadership to the service, that we will also be identifying where there are deficiencies in terms of that kind of leadership. Through the Commissioning Board and currently the primary care trust clusters, making sure that there is not only the assignment of staff, but there is the support in terms of resources to develop leaders in relation to consortia that need it.
Okay, thank you very much. Andrew, thank you very much for your time. Yeah.